Welcome to our channel, HASHMICLINICS.
Welcome, everyone. In this session, we're going to build a complete and practical clinical portrait of a really crucial remedy, Antimonium Arsenicosum.
So let's start with a scenario you've probably all seen. A patient comes in and you hear it immediately, that deep, rattling mucus you know so well from Antimonium Tartaricum. But they also have that profound exhaustion, that anxious, can't-stay-still restlessness, and the classic thirst of Arsenicum Album. What do you prescribe?
Well, this is the exact moment where Antimonium Arsenicosum steps onto the stage. It's the perfect remedy, a powerful tool that bridges that gap between its two parent remedies. So let's really dive into its unique picture.
Here's how we're going to break it down. We'll start with the remedy's core essence, move into the constitutional picture, look at its key organ affinities and triggers, and then wrap up with its clinical use and how to tell it apart from other remedies.
Okay, first things first. What is Antimonium Arsenicosum at its heart? You see, it isn't just a simple mix of its parts. It's a completely unique and distinct pathological state.
We call it a synthetic prescription. Now, that's not a chemical term, it's a clinical one. It just means the remedy is a perfect fit when the patient's symptoms are a true synthesis of both components, a situation where neither Ant-Tart nor Arsenicum alone can cover the whole case. It's an elegant solution to a common clinical problem.
Now, even though this remedy has this dual nature, the constitutional foundation, the bedrock of the case, is almost always built on that classic trio of symptoms it inherits directly from arsenical. And these three generals are absolutely non-negotiable. I'm talking about a prostration that's way beyond just tired, an anxious, almost agonizing restlessness, and that telltale thirst, often for just little sips at a time. If this tripod of symptoms isn't there, you're almost certainly looking at the wrong remedy.
So with that Arsenicum foundation firmly in place, let's see where this remedy really focuses its action in the body. And its sphere of influence is remarkably precise. It has this incredible precision, zeroing in on the cardiorespiratory system. We see a strong affinity for the lungs, especially the upper left, the heart muscle itself, and critically, those serous membranes, the pleura around the lungs and the pericardium around the heart.
This quote just nails its core pathology, doesn't it? It points to this intense inflammation of those serous membranes, pleurisy and pericarditis, that quickly leads to fluid buildup, either as an exudate or an effusion.
So clinically, what does this look like? You get this suffocating difficulty breathing, a chest that sounds like it's full of bubbling, rattling mucus that the patient is just too weak to cough up. This is the remedy you think of for emphysema, and very characteristically, for those pneumonias that just refuse to resolve, the ones that linger and threaten to become chronic.
All right, let's turn to the modalities, those circumstances that change the patient's state. For Antimonium Arsenicosum, these are incredibly sharp, clear, and have the highest diagnostic value.
These two aggravations are absolute keynotes. The cough, the breathing, the whole state, it all gets reliably and significantly worse after they eat anything, and the moment they try to lie down. You have to ask about these two modalities. If you don't, you're very likely to miss this prescription.
A classic entry point for this remedy state is after the flu. The acute phase is over, but the illness just goes to the chest. It develops into this deep, stubborn pneumonia that leaves the person in a state of complete and utter exhaustion. Now, beyond the chest, this remedy has a few other peculiar symptoms, and when you see them, it can really help to confirm your choice.
So you want to look for any puffiness or edema of the face, check for inflammation in the eyes, and then there's this really peculiar confirming symptom, wandering, shifting pains along the sciatic nerve. I know, it sounds totally unrelated to the cardiorespiratory crisis, but if you see it, it's a huge pointer toward our remedy.
And now for the most practical part, how to confidently tell this remedy apart from its closest relatives when you're at the bedside. This is really where cases are won or lost.
The whole differentiation really hinges on this. Antimonium Arsenicosum has the deep mucus rattling of Ant-Tart, but it's combined with the anxiety, the restlessness, and the thirst of Arsenica. This immediately separates it from the sleepy, drowsy, thirstless state of Ant-Tart, and it separates it from the often drier, more wheezing cough of a pure Arsenicum picture.
So, to sum up your prescribing pearls, when you see that triad of rattling mucus, profound prostration, and anxious restlessness, your mind should immediately jump to Antimonium Arsenicosum. Then, you just confirm it with those keynote modalities, worse after eating and worse lying down. That's your core formula for a successful prescription.
This is such a powerful, but so often overlooked remedy. It really holds the key to resolving these complex cardiorespiratory cases where the more common prescriptions just haven't worked. It's one you'll want to have in your clinical toolkit.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.